Pneumonia in children, causes and symptoms. Pneumonia is a serious infection of the lungs in which air sacs in the lungs called old alveoli fill up with pus and other fluid that in turn makes it hard for oxygen to reach the bloodstream. Respiratory tract infections are quite common in children, affecting 150 to 156 million children under the age of 5 each year. Occasionally these infections will develop into pneumonia, inflammation of the lungs, because their immune systems aren't fully developed. According to the World Health Organization, WHO, pneumonia claims the life of a child every 20 seconds and accounts for 16% of all deaths of children under age. Causes of pneumonia in children. Getting wet doesn't cause pneumonia. An infection in the lungs from a variety of germs, viruses, bacteria, fungi, and parasites does. A cold or flu left untreated can get worse and turn into pneumonia. That's because the cold or flu will irritate the lungs, creating an environment where it's easier for pneumonia germs to move in and start an infection. All types of pneumonia are due to a lung infection. Pneumonia is usually caused by an infection with the bacterium Mycoplasma pneumonia. Some cases of pneumonia can also be caused by a respiratory virus, such as adenoviruses, rhinovirus, influenza virus, flu, respiratory syncytial virus (RSV), and parainfluenza virus, which also can cause croup. Smoking around a child will make your child more susceptible to catching pneumonia. Certain living conditions, such as very crowded spaces or homes with significant air pollution, can also contribute to lung infection, especially in children. Children who have other health conditions or lower immune systems are also at risk for pneumonia. Symptoms of pneumonia in children. Unlike adults, children who have pneumonia may not experience the nagging cough or fever, and may have signs of infection that are much more subtle. Mild pneumonia in children. One of the most common types of pneumonia is walking or mild pneumonia caused by certain bacteria, including Mycoplasma pneumoniae and Chlamydophila pneumoniae, have symptoms similar to the symptoms of a common cold. This type of pneumonia is prevalent among school-age children. A child with mild pneumonia may not feel sick enough to stay home and will usually eat and sleep normally, and have normal bowel movement. Some of the main symptoms of walking pneumonia include dry cough lasting more than 7 days, low-grade fever, temperature of 101 degrees F, headache, chills or body aches, decreased appetite in older children, chest or rib pain, feeling of tiredness or discomfort, labor breathing in severe cases, wheezing, which is more common in severe viral infections, moderate pneumonia in children. Viruses cause most of cases of moderate pneumonia in preschool children between ages 4 and 5. Affected children will usually have symptoms, such as sore throat, cough, low-grade fever, nasal congestion, diarrhea, loss of appetite, tiredness or lack of energy, severe pneumonia in children. These types of pneumonia often develop more abruptly than a cold or virus and result in more dramatic symptoms, such as high fever, sweating or chills, flushed skin, a bluish tint to the lips or nail beds, wheezing, difficulty breathing. Pneumonia in newborns and infants. Newborns and infants may not show typical signs of pneumonia infection. It may also be difficult to determine if toddlers have the illness because they may not be able to communicate how they feel as well as an older child can. Still, the following symptoms can indicate that a baby or young child may have pneumonia: looking pale, being limp or lethargic, crying more than usual, feeding poorly, being irritable or restless, vomiting. If you liked the video, please subscribe, like, comment or share.